Hello, everyone, and welcome to today's Lunch and Learn, hosted by the Center for Living Organ Donation at UHN. My name is Paula Neves, and I'm the lead for the Center for Living Organ Donation, which was established in 2018 to raise awareness and improve access to living organ donation and transplantation. Today's session will focus on living donor liver transplantation and the living donation process. Our first speaker is Dr. Mark Cattral, who many of you know well. Dr. Cattral will be providing an overview of the indications for liver transplantation and the role of living organ donation in improving timely access to a life-saving transplant. Dr. Cattral will be followed by Chantal Wiggins, a nurse and a transplant coordinator with the Live Donor Liver Program. Chantal will be talking about the living donor assessment process and answering your questions on Facebook Live. Finally, we will be joined by two patient partners, Liz Venderbos, who is a living donor liver transplant recipient, and Melissa Sidhu, who is a living liver donor and a member of the Advisory Council of the Center for Living Organ Donation. I would now like to welcome our first speaker, Dr. Mark Cattral. Dr. Cattral?
Yeah, thank you, Paula. As Paula mentioned, I am the surgical director of the Live Donor Liver Program, and I'm going to give you some background about the program and the indications for transplantation. And then I'll turn things over to Chantal, who can we'll go over some of the assessment process for living liver donors. So as far as our program is concerned, the program at Toronto General Hospital is one of the largest liver programs in North America. And to date, we've transplanted over 3,000 adults. And of those, 900 have received living donor grafts. In a typical year, we perform over 200 liver transplants, of which about 60 to 70 are living donor grafts. I should also point out that the team at Toronto General also provides transplant care for patients at hospital for sick children. Next slide. So there are a number of liver diseases that we treat by transplantation. Historically, hepatitis C was the dominant indication, accounting for anywhere from 40 to 50% of our transplants. But over the last decade, the number of patients with hepatitis C has declined with the advent of better therapies and curative therapies for hepatitis C. A number of patients with hepatitis B may require transplantation. Increasingly, we are seeing a number of patients who have end-stage liver disease related to a condition called NASH, or fatty liver disease. Some of our patients have end-stage liver disease related to alcohol. There's also a subset of patients who have diseases that are thought to be autoimmune in nature, such as primary sclerosing cholangitis and primary biliary cholangitis. And also, cancer has become an important part of liver transplantation. Up to 40% of our patients have liver cancer as their dominant indication, although I should point out this is on the background of some of these other conditions that I've already mentioned. Next slide. So a liver transplant is life-saving, and it also improves quality of life. So by the time many of our patients come to transplantation, they're actually quite sick. Some of them are housebound or even hospital-bound, and with a liver transplant, we can restore their health so they can return to their normal daily activities and get back to work and enjoy life. Next slide. So there are two potential ways in which someone might be able to receive a liver transplant. The traditional method or traditional path is through deceased organ donation. And the alternative would be a living donor liver transplant. So to receive a deceased organ, or for that matter, a living donor graft, you have to fulfill certain criteria that are defined by our organ procurement organization, which is known as the Trillium Gift of Life, or TGLN. For deceased donors, the livers are allocated based on a scoring system called the sodium MELD score. Can I go to the next slide, please? So the sodium MELD score is derived from 4 blood test values: the bilirubin, creatinine, INR, and the serum sodium concentration. So these numbers are obtained from routine blood work, and the numbers are placed into a formula, and this formula then generates a score. So if you do not have liver disease, a typical MELD score or sodium MELD score would be 6 or 7. Most of our patients who go on our waiting list have scores above 15. The system is designed to treat the sickest patients based on this scoring system. So in general, as patients become sick with their liver disease, their MELD score will increase. And in our setting, most of the patients who are offered livers or deceased donor livers have MELD scores that are over 30. So most of those patients are generally quite sick at that point in time, and many of them are in hospital. This system does not work very well for patients with liver cancer because they generally have a relatively normally functioning liver. And so to accommodate that, we give them exception points. And so we generally start them off with 22 points, and every 3 months it increases by 3 up to a maximum of 30. And so for a patient with liver cancer, the expected wait time can be about 9 to 12 months. Next slide. So while waiting for a deceased donor liver, you should try to maintain your health. We have our hepatologists are very much involved in ongoing care of our patients on our waiting list. We have dedicated coordinators who look after the patients on our waiting list, and if there's any concerns, that they should be contacted. The MELD score has to be updated regularly, so it can fluctuate over time. And so every month, blood work has to be obtained so we can update the MELD score in the system. And obviously, if there's any changes in your condition, you need to contact our coordinator. So I think at this point, I'm going to turn things over to Chantal, who's going to talk a bit more about the living organ donation pathway.
Thank you, Dr. Cattral. My name is Chantal. I'm the Living Donor Coordinator. I'm a nurse coordinator. So I work with a multidisciplinary team to ensure our donors are safe and informed, and I coordinate all their care from application all the way to after they've given their liver, and I take care of them post-operatively as well. So I'm going to go through a few slides to describe a little bit about the donor journey. So benefits of a living organ donation. Obviously, this is a life-saving transplant with minimal waiting time compared to waiting for a deceased donor. A faster return to good health and good quality of life for the recipient. Better long-term outcomes and better quality organ. And donors gain deep satisfaction from saving a life. Next slide, please. Living liver donors. So donor safety is our #1 priority. We ask donors to be the age of 16 to 60 years old. You need to be in excellent physical and emotional health, and you need to have normal liver function. You also need a great support system from family, friends, primary care doctor, and community and your work. If you don't, that doesn't exclude you, but we would offer more support. This is a voluntary choice, and there's no compensation for being a donor. Next slide. UHN's Living Liver Donors and Recipients. Here's a little bit of a profile of some of our donors. So 2/3 of living donors are related to the recipient. Among genetically unrelated donors, 1 in 5 are spouses, 45% are friends, 4% of living donors donate anonymously. 2/3 of living donors are women, and the median age is 35 years old. Next slide, please. Protecting the health and safety of our recipients and living donors is a top priority for our team. So we follow very strict international guidelines for liver donor assessments and you can find them on our website at uhnTransplant.ca. A key component of our process is that we have two separate teams. So one is for the living donors and another is for the recipients. So each team has a coordinator and their primary physician or surgeon involved. And this is to protect the privacy and the best interests of each parties involved. Here are some practical considerations. We only assess one donor at a time, and we only start assessing once the recipient is listed. Donor workup takes approximately 4 to 6 weeks, but this timeline can vary, and it can take up to 12 weeks depending on the donor situation and availability. Please note, as 1/3 of donors can go through the process, 2/3 are excluded due to anatomy reasons or maybe medical reasons. This can also make the timeline a lot longer. So if we need to find multiple donors to be worked up, you may not be able to get to transplant within that 8-week time frame. OHIP covers the cost of surgery and the hospital care for both the recipient and the living donor. The Trillium Gift of Life Network offers a program, the short form is called Preload, and this can cover up to $5,500 of living donation related expenses. And you can look at the Trillium Gift of Life website for more information. We will also discuss this with you during your donor workup, and you will also have the time to speak to a social worker about this program. In Manitoba, they also offer a program, Manitoba Gift of Life, with some living donation related expenses as well. And for the Trillium Gift of Life Network, it's eligible for coverage even if the living donor lives in another province or another country. How do I become a living liver donor? You may be asking this. You can complete a donor health history form, which is very in-depth and asks a lot of very detailed questions. And you can find that on our website at Transplant.ca. You can submit this completed form along with a copy of your blood type obtained from your family doctor or a picture of your blood donor card. And then you can fax it or email it to the information below here is livingdonorliver@UHN.ca. The fax number is there as well, and the phone number. And you can wait for us to call you, and you will get a call from myself once I review your application. While you wait, the Center for Living Organ Donation offers wonderful support. They have living donor champion classes. For those who would like more information on finding a living donor, you can visit givelifeuhn.eventbrite.ca for more information. I'm going to pass this back to Dr. Cattral to talk about some more information about living organ transplantation. Cattral.
Sorry about that. Thanks, Chantal. As far as liver donation is concerned, the popularity of this procedure varies depending on where you are in the world. In Asia, it is very popular. In countries such as Korea, several hundred transplants per year are done with living donors. It's increasingly popular in India, as well as the Middle East. It's been less popular in Europe and the United States. We're kind of an outlier in the Western world in that over 1/3 of our transplants are performed with living donors. Next slide. To date, as I mentioned earlier, we've done over 900 liver transplants with living donor grafts. So we have a lot of experience. The surgery itself, I should take you through the process. As far as the living donors are concerned, they're admitted to a hospital on the day of the surgery. They usually come in around 6 o'clock in the morning. They would meet the nurses who would start to prepare them for the surgery. And around 8 o'clock in the morning, they would be brought into the operating room and meet the anesthesia. Once asleep, anesthesia places a number of monitoring lines. And the surgery itself usually gets underway around 9 o'clock in the morning. The surgery takes about 6 hours. And following the surgery, the patients are transferred to our recovery room for an hour. And then from there up to one of our step-down units, which is like an intensive care. By that I mean, you'll have your own nurse, and all your vital signs will be monitored continuously. And then after a couple of days, the donors are transferred to a regular floor bed for another few days. So the typical time in hospital now is usually about 5 to 6 days. It's gone down over the last 10 years. Initially, it was about 7 to 8 days, and now it's about 5 to 6 days. It is a big operation. It does take time to recover. Most donors will experience a feeling of tiredness that usually persists for a few weeks. And usually by week 3 to 4, most donors feel like they're back on track and getting back to normal. Usually by week 6 to 8, they are back to normal. And that's usually the time when most donors return to work. So the liver is an amazing organ. It has an amazing regenerative potential. We used to think it took about a year for it to grow back, but in fact, it grows back much more quickly than we thought. And the liver is almost back to a near normal size after several months. I should point out that for the types of surgery that we do, for the pediatric donors, we remove what's often referred to as the left lateral segment. And in that diagram that's shown here, that would include segments 2 and 3. And then for the adults, we would remove the right lobe, which consists of segments 5, 6, 7, and 8. I should point out that these numbers refer to the internal blood supply of the liver. Next slide. And as far as the recipient is concerned, as I mentioned, the main advantages of receiving a living donor transplant is first and foremost getting the transplant, and second, getting the transplant when you're still relatively healthy. So the recipients are able to recover much more quickly than they would if they have to wait for a deceased donor organ, and they can get back to better health much sooner. And then as far as the post-transplant care, it's essentially the same whether you have a deceased or a living donor transplant. We have a dedicated team of hepatologists and nurse practitioners and nurse coordinators who will be involved in your post-transplant care. I think that's next slide, please. So I think, Paula, we're going to move on to the patient stories.
Thank you, Dr. Cattral, and thank you, Chantal. I'd now like to invite our patient partner, Liz Venderbos, to share her and Ty's story. Liz?
Thank you very much. So my story is quite lengthy. However, I'm going to try to shorten it as much as possible. My sister had passed away of colon cancer. So unfortunately, that meant I had to go for a colonoscopy on a very regular basis. And at that time, my mom was just diagnosed with terminal cancer. I had seen my family doctor, and he basically said, "You haven't been for a colonoscopy, you need to go." And of course, you know, being a workaholic at the time and dealing with my mom's sickness and everything else going on, you know, I have no time for this. Fortunately, my doctor had said, "No, you're going," and he made the appointment for me. When I was there, the doctor just asked me the right questions, asked me some personal questions about going to the bathroom if things were different. And he just hit it right on the head and said, you know, there's something wrong with your liver, just by my answers. And he said, we need to start testing you. That was June of 2013. And then he started doing testing, and so it was CT scans to blood work to everything that you can imagine until March of 2014. He called me into his office and he said, "I'm sorry to tell you, you have liver disease." After that, I don't really remember what he said. I didn't hear anything. Everything was basically underwater. Dealing with my mom being just passed away and taking care of my dad, finding out I'm sick, you know, it was a lot at once. So there was a lot on my plate, and then they had admitted me to the hospital a few days later to get some tests done again and to meet a liver specialist. At that time, I met the liver specialist after all those tests were done in the hospital, and they confirmed that yes, I have liver disease, and it was primary biliary cirrhosis is what they called it at the time, but I believe the name has changed. But that's how I know it. So throughout that time, I was going for blood work tests on a very regular basis, about once a month, and started seeing Dr. Peretz, which is a liver specialist here in Winnipeg. Went to him very regularly, and during that time, taking care of my dad, working 20 different hotels across Canada, very, very busy job. It was just a lot at once. So then my dad had passed away, and of course, as Dr. Cattral had mentioned, they watch your MELD score. Just as my dad passed away, that following week, I had to get my MELD score checked again, and it went from 16 to 26 in a short period of time. So at that time, Dr. Peretz had said, you know, we need to get you on a list right away. This is a big jump. So at that time, they put me on a list, and that was June of 2015. So throughout that time, again, a lot more testing, keeping an eye. My brother was the first one that stepped up to be tested. Unfortunately, he was not a match. The second person, my very good friend, she got tested, and it was great right up until the end. They said her liver was too small to match for mine. So that was unfortunate. In the meantime, I was getting more and more sick and feeling nauseous every day, very itchy all over, to the point where it starts to make you a little crazy. And then November 2015, all my friends put a fundraiser together for me because they don't do transplants here. They put a fundraiser together for me because they knew I had to go to Toronto. And there was almost 700 people there, which to this day just blows me away, you know, how people really step up and support you during those times. Right after that fundraiser, my son that you can see in the picture, he was 21 at the time, and he said, "Mom, I want to be tested." And because he was my son, there was no way I wanted him to do that. And he basically said, "I'm a man, let me be a man, I'm going to do this." So very scary, but we flew to Toronto in December of 2015. He got all the tests done, and we were at the airport in Toronto waiting at the gate to come back to Winnipeg. And he got an email from Toronto General saying, "Your next appointment is January 6th. So he said, you know, that's kind of odd. And I said, well, they probably just make the appointments just in case, because they probably fill up quickly. I said, but let's phone them. You know, whoever sent you that email, let's phone them right away. He grabbed my phone, walked away. He phoned them, came back, handed me my phone, and he said, "Yeah, I have to keep that appointment." And I said, "Okay." He said, "Yeah, because I'm a match." And just like that. And it was like I was holding my breath for a couple years. And as soon as he told me that, I started crying right in the middle of the airport. And my husband's a corrections officer, and he was at work. So I phoned him at work, which probably wasn't the best for him. His wife crying, and he's watching all the bad guys. So he started crying and said, "I can't talk to you about this," and hung up on me. So we called every person that we could think of, telling them the good news. So that was a really great Christmas gift that year. And we were told that we had to come back in January. My son needed some more testing, as far as mental testing, as far as, you know, are you doing this on your own? Is no one forcing you to do this? Those kinds of questions. So we went back again in January, and then a week later, January 18th was my surgery. We both went in, and it is amazing what everybody does at that hospital, because it was top-notch service that we got there. Took care of my son amazingly well, took care of me amazingly well. You know, it was a great experience that way. Everyone was very caring and understanding. So I can't say enough about that hospital, that's for sure. And soon after my surgery, within days, the itchiness stopped, the nauseous feeling stopped. It was just amazing. My color came back. As you can see in some of these pictures, my skin is in rough shape. And now, you know, 4 years later, I feel amazing. I go to the gym every day. I eat healthy. I take care of myself, and I think that's the key. You know, it's it's amazing what, you know, everyone has done for me there, including my son, of course. And the thing that I think that's great about telling your story like this, for both sides, is that, you know, you really got to keep reminding yourself that you're not alone going through this. And I hadn't known anybody that dealt with this. And I think it's really important to reach out and find somebody that can be that person that you can reach out to and ask questions and cry to, because, you know, unless you've been through it, it's really hard to understand exactly what you're feeling. So, you know, I would recommend that to anybody that's going through either side, is reach out to that person, reach out to, you know, somebody that can talk to you about it besides a physician, somebody that, you know, has been through exactly what you've been through, and it would be really helpful. So, and I guess the last thing I want to say is what I've learned from this is, you know, recognize those signs from your own body. Don't ignore them. Apparently it was happening to my body for about 5 years before I realized. And thank goodness that doctor that, you know, had nothing to do with the liver, just asked me the right questions. So don't ignore your body and tell your doctor everything. Those are the two things, you know, that you really have to remember when you're going through stuff like this. So thank you.
Thank you, Liz. Hearing your story is so important. Hearing patient stories is so important. And thank you for taking the time to share it with us today.
Thank you.
We have another patient story for you today. Melissa Sidhu is a living liver donor, and she made a life-changing decision to donate a portion of her liver to her brother Donald, and I'll turn it over to her to share her story now.
Hello, everyone. My name is Melissa Sidhu, and I was able to donate 65% of my liver to my younger brother Donald on March 7, 2011 at Toronto General Hospital. When my brother Don was born, he was diagnosed with biliary atresia, which meant that he, in his case, was born without a bile duct. He received a life-saving procedure called the Dr. Morio Kasai procedure, which allowed him to live until he was old enough to receive a liver transplant. And then normally babies with this condition usually live until maybe 3, 4, 5 years of age before they require a liver transplant. But fortunately, this Kasai procedure allowed my brother to live pretty much a healthy life until he experienced liver failure when he was age 35. And he was placed on the Toronto General Hospital liver transplant wait list. At the time, I was actually working at the University Health Network Research Ethics Board, and my brother was told that the wait time would be at least 12 to 18 months. And I knew, working at UHN, that those numbers definitely stood still. As my brother was a type O blood type, the wait list is quite long. So there was no wiggle room with that that timeline, because once he got into liver failure, you could definitely see the signs. The bilirubin levels went up, and he was always so jaundiced, weak. He worked until he was too weak to actually get to the office. So I anonymously came forward to be a living liver donor the day after he was placed on the wait list at Toronto General Hospital. I didn't want to tell any of my family members at first because I worked in research ethics. I wanted to make sure that my application would go forward to the Toronto General Hospital team without any concern that I was being coerced by any family members. And of course, I was doing this on my own volition. It was my own decision. And so my brother, of course, once he found out that I came forward as a donor, he really did not want me to proceed because he was very scared for me. And it took some convincing, and I had to sort of negotiate with him that I fully understood the risks, because I work in medical research and I used to write research protocols and research participant consent forms. I could tell you anything about risks. I've worked in cardiology, oncology trials. So this time I found myself on the other side. For the first time, I was going to be a patient. And it was definitely an amazing experience because I actually got to be on the other side and learn what it was like to put myself in someone else's shoes and wonder, like, is this gonna be okay? Am I now going to experience surgery for the first time? And to be honest, I really didn't want to wait and watch my brother become more sick. As Dr. Cattral mentioned earlier, the better the patient is in terms of their health going into the surgery, the better their outcomes after the surgery. And I had to make sure my brother was aware of that. And I, at the time, was enough to be in excellent health. So once I found out I was a match, it was all green light and systems go. And I honestly didn't have time to be afraid. I was knee deep in work, and I had to make sure that all my projects were in order to take my sick leave after the surgery. So it was great because I really didn't have time to stop and be afraid. I literally finished my projects the Sunday night, and then Monday morning I was in surgery before 6 a.m. checking in for surgery at Toronto Gen. And so I honestly never believed that I would suffer any negative side effects and that my brother and I would be fine, as we were in the hands of the Toronto General Hospital Living Donor Transplant team, which is actually one of the top in the world. And it's funny because I was working at UHN at the time and I didn't even know about the program because there's just so many other things going on at UHN all the time. And to be part of this was quite a life-changing experience. And my brother ended up responding so well to my liver that he was able to leave the hospital and go home 1 week earlier than planned. It felt like Christmas in March, to be honest. And I would highly recommend this experience to anybody.
Thank you.
One more moment, I'll be fine. Dr. Cattral saved my brother's life. Thanks to him, my brother was able to get married, have a daughter, and experience fatherhood. And if I had to do it all over again, I would do it in a heartbeat. Definitely. The team at Toronto General Hospital is amazing. And they were all, it's almost as if they were handpicked and born to be part of this amazing team. And it definitely shows. Thank you.
Thank you, Melissa. Those are important words for the team to hear, but also important words for our audience to hear, because we do have an excellent team here. And so thank you very much for sharing your story. And we've now reached the Q&A portion of today's session. We've received a lot of questions in advance. So today we'll address those questions. And then any questions that we receive via Facebook Live will be addressed by our team directly, or at a dedicated Q&A session on liver transplantation and living donation we'll be hosting later in September. So stay tuned for that. So I'll now turn it over to our panel to address the questions. Many of those were for Chantal and Dr. Cattral. So this first question is for you, Chantal. This is from a patient who's on the liver transplant list and wonders how COVID is impacting surgeries and how the no visitors policy is handled for transplant surgeries.
Okay, so I'll be happy to answer this. So a little bit about donors and evaluation. Most of our consults are done virtually now by phone or video. If you are coming to the hospital for your imaging, like CT and MRI, chest x-ray, etc., those are still happening on site. You will be asked to come alone and wear a mask. There's universal masking for all patients and staff in the hospital. Regarding the surgeries, COVID, we are doing COVID testing anywhere from 24 hours to 72 hours prior to your scheduled surgery, and that is for donor and recipient. And those all have to come back negative, of course, before we proceed to surgery. We are still doing surgeries. We are having our donors donate through this whole time. The visiting policy has changed recently, and donors are allowed to have one visitor with them the day of surgery, and the same visitor can visit 2 to 3 hours per day for the week following after surgery. Same as for the recipient. However, after 1 week, the visitors have to be reevaluated and discussed with the nursing team on the unit, because it's supposed to be valid for 7 days. I think that is it, unless Dr. Cattral has anything else to add. And the other questions, I think, are more for him to answer.
Thank you, Chantal. So Dr. Cattral, this next question is for you. It relates to innovations to reduce anti-rejection drugs. Are we using things like dendritic cell transplants?
Well, thanks, Paula. With any transplant, unless you have an identical twin, you'll need to be on immunosuppressive therapy. And that's because the recipient's immune system will recognize the liver as being foreign, and then the immune system will do what it's designed to do, and that would be to attack it. So without immunosuppression, rejection is actually a very rigorous, vigorous response, and most grafts would fail within a few weeks. So immunosuppressive therapy is used to dampen that response. And initially we have to use fairly high dosages of these drugs, but for reasons that are not entirely clear, most patients do accommodate to their liver, and over time they need much less immunosuppression later on as they do compared to what they need at the beginning. Now, the ultimate goal in transplantation would be to do a transplant without any immunosuppressive therapy, and we have an interest in this area as well. Dr. Levy, who was shown in one of the previous pictures, has a number of trials underway to look at alternative strategies to avoid or minimize immunosuppression. The program in Pittsburgh is interested in an approach using dendritic cells, and they have an expertise in this area because one of their scientists, Dr. Angus Thompson, has been working with dendritic cells for the past 3 decades. And so they are uniquely positioned to look at this approach. And at the moment, we are not using dendritic cells. We're looking at these other strategies, and time will tell which one of many will provide a solution to rejection.
Thank you, Dr. Cattral. The next question relates to donor testing and the timing of donor testing, because one of the most difficult things for potential recipients who are on the list is the wait to find a match and to find the donor. So potentially, I guess the question here is whether we could have, whether there's a way to test donors and have donors pre-qualified before someone actually needs a transplant. That may be what this person is getting at. Chantal, maybe I could start with you just to talk about the donor at a time testing policy, and then what you do in terms of folks who may be on the wait list but may not yet be ready for transplant. Maybe that portion of the question could be answered by Dr. Cattral, but we'll start with you.
Okay, so we do ask for people to wait to submit their applications once their recipient has been listed, and they will get a call from their coordinator, their nurse coordinator, once they are listed, and they will get a package in the mail explaining everything to them. Then they can have their donors submit applications. Then once we get all the applications, it can vary from 1 application to 50 applications. We review all applications, and we will get an email saying that we've reviewed it and we have it, and we will call you if required. So we need to look at the applications to match the recipient and the donor as best we can for their size. Obviously, a good standing health. Some health conditions will automatically exclude you. So we will call you and let you know what that would be. And that can sometimes be related to high body mass index, so obesity, diabetes, sleep apnea are some of the things. I'm not going to go through everything, but we will discuss the reasons why we can't move forward with your application. Other times, the applications are kept on file. We may start the most appropriate donor based on size and health, but we have many others on file in case we need it. So we work up 1 donor at a time. And it can take, as I said, a month to know if this donor is suitable. And what we're looking at is the size of their liver, their overall health, and the anatomy of the liver. So not everyone can be a donor. If they are a match, we will let them know, and then we will proceed on to the preoperative testing phase and preparing them for surgery. If you're not suitable, then we will go back to that file of many other possible donors, and we will go to the next most appropriate donor. So sometimes people will call us and check in saying, you haven't called me. And that is the reason why we explain in the email, we have received your application. We really appreciate it. We look at every single one, but we can only start up one. And we will have your application on file until the recipient gets their liver transplant. So you could be called 4 months later stating, we need to start your workup. Are you comfortable moving forward? So that's a little bit about the timelines.
Thanks, Chantal. And Dr. Cattral, is there anything that you would add?
No, Chantal covered that very nicely.
Thank you. I think we've got more questions. And I think this one is for you, Dr. Cattral. What determines the right time for transplantation in PSC? And wondering how the decision to enroll the patient in assessment and listing process is made.
Well, that's a good question. And I have to admit to you that we rely heavily on our hepatology colleagues to help us decide when is the right time. There are many patients with PSC who actually have an excellent quality of life and have very few problems related to their PSC. Once patients start getting into trouble with infections in their biliary tree that are commonly known as cholangitis that results in fevers, or if they're becoming jaundiced or yellow, or they're becoming itchy, or they're obviously developing symptoms related to the liver disease, that's usually the time when we start thinking about transplantation. But again, as I said at the beginning, we do rely heavily on our hepatology colleagues to help us with that decision.
Thank you. We've got 2 more questions on this slide. I think we've answered the last one, but the middle one is regarding alternatives to heal or postpone or delay the need for transplant. So could you comment on these options?
I have to admit to you that I'm not familiar with the treatment that's being mentioned in this question, liver and gallbladder flushes. As far as I'm aware, I don't know if there's any evidence to suggest they're effective, but I honestly don't know what's involved with that particular treatment, so it's hard for me to comment. But in general, unfortunately, for many liver diseases, there is no specific treatment. And once the scarring process starts, it often continues relentlessly. And ultimately, the patients will require a transplant as the only potential treatment.
Thank you. I believe we received a couple more questions. Again, these are for you, Dr. Cattral. Would menopausal symptoms affect donor qualifications? Maybe you could start, and Chantal could also talk a little bit about this.
No, that would not disqualify an applicant for menopausal symptoms. That's not a concern.
Great, thank you. And then are there any contraindications to living liver donation for someone with congenital disease like Marfan syndrome?
Well, Marfan syndrome, if they have bona fide Marfan syndrome, that would be a contraindication. There are some patients who have a Marfanoid appearance, and sometimes it's suggested to us by a radiologist that we should consider Marfan syndrome, and in those patients we will do more formal testing and sometimes genetic testing. In most cases, they do not have Marfan syndrome, but if they were confirmed to have it, we would not proceed with living donation.
Thank you. I think we've reached the end of the questions submitted in advance. So thank you everyone for sending in your questions. And please keep them coming. We will address them directly, and we'll also address them at our September webinar. There will be a Q&A portion of the webinar, and we hope that Chantal will be available to address some of the questions that will be coming through that webinar as well. I would like to thank our speakers today, Liz Venderbos, Melissa Sidhu, Chantal Wiggins, and Dr. Mark Cattral. I would also like to thank the Center's Communications Coordinator, Courtney Mart, for putting this event together. If you would like to learn more about liver disease, liver transplant, and living donation, please visit livingorgandonation.ca. And also, please join us for Living Donation Week, September 14th to the 18th, as we host a week-long series of online webinars, Q&A sessions, and celebrations. We will have more information on all of these events, plus other webinars, on our Eventbrite page. So we encourage you to check that page and to register in advance, and also to follow us on social media and stay up to date on Center News. So thank you again to our speakers. Thank you all for joining us on Facebook Live, and we'll see you next month.